A new committee will continue into a new legislative session. I'm Jill Horner. This is Comcast Newsmakers. With me is Pennsylvania State Representative DiGirolamo. Thanks for being with us.
Jill, good to be with you.
We're talking about the Human Service Committee.
Yep.
This was created in the last legislative session, and
Correct.
you served as the first chair. What's the purpose of this committee?
Well, human services, pretty simply, it's those people who need services for mental health, people with disabilities, physical disabilities, intellectual disabilities. Also, very important part of the committee is people who have drug and alcohol problems and need help with treatment. The committee spans across two very big departments in Harrisburg. We have a lot to do with the Department of Public Welfare, not all, some of it falls in the Health Committee, and also a lot to do with the Department of Health also. So it's been a pretty interesting experience the last 2 years, and I've really enjoyed my time serving as the majority chairman.
And you are looking to continue in that capacity as well. Let's talk about some of the upcoming issues for this legislative session. One of the issues that you'll be addressing is a prescription drug monitoring bill. There's a companion bill in the Senate.
Correct.
What's the purpose of the bill?
Well, prescription drug abuse, epidemic, not only here in southeastern Pennsylvania, but across the whole state. The doctors and the pharmacists have been crying out for a long time to be able to have a database so that they can look on their computers in their doctor's office, in the hospitals, in the emergency room, and see if the patients that they're prescribing these addictive medications are doctor shopping, pharmacy shopping, are they addicted, or are they trying to get these narcotics to sell on the street? So what this will simply do will be the pharmacist will have the responsibility for entering the information into a database. It's scheduled 2, 3, 4, and 5 drugs. They are all the addictive medications. The pharmacist will enter the information in the database, and then doctors will be able to go on their computers and be able to tell if they have a new patient or an old patient, if they've been kind of like doctor shopping or getting these medications from other doctors.
That's just one of the issues that you'll address as part of this committee. Will you also look at the pilot program that will look at block granting money for human services? This is going to take place in 20 counties in the Commonwealth.
Yep, in next year. And I have, it's no secret, I've been an opponent of this block grant idea for human services. The proposal, the administration in 2012 proposed a full statewide block grant for the 67 counties. We were able to get it down to a 20-county pilot program block grant. There's 20 counties across the state of Pennsylvania that they're going to start block granting human services in 2013. I'm opposed because I am just philosophically opposed to block granting of human services for these populations. And again, we're talking about our most vulnerable citizens, mental health, people with mental health issues, disabilities, drug and alcohol problems, homeless children and youth. I just feel that you are going to be pitting these poor people against each other for services within the county and for this funding. So I am just opposed, but we are going to have a pilot program, so they anticipate to get it up and running in 2013, in early 2013.
So just a few seconds left, but you're more in favor of money going to designated programs rather than in a lump sum.
That's the way it's been traditionally. Traditionally in the budget, there's 7 different line items and 7 different money, and the money's dedicated to these services.
Come back, give us an update. Let us know how all of these issues are being addressed as part of the budget process as well. We've been talking with Pennsylvania State Representative DiGirolamo. I'm Jill Horner.